All right, they can just filter in as they come. So today we have the privilege of hearing from Keeley White with the Regional Food Bank of Oklahoma. She is currently working on her master's in public health and works at the food bank as the director of health and senior programming. Today we are really excited to hear her speak on fighting for food security in Oklahoma. So with that, Keeley White, take it away.
Thanks, Bailey, and thank you everyone for having me. I stepped outside today for about 5 seconds and instantly regretted it. So I hope you are all staying warm. It is so cold out there. Okay, so can you all see my screen okay? Hopefully. All right, let's get started. So first, before we get started, I want to talk to you a little bit about the food bank for those who don't know. So we are a private nonprofit here in Oklahoma, and we are actually the largest domestic hunger relief nonprofit in the state. So there are actually two food banks in Oklahoma. So our food bank and then the Community Food Bank of Eastern Oklahoma, which is housed out of Tulsa. So our area covers 53 counties of central and western Oklahoma, and then the Tulsa Food Bank covers kind of the eastern portion of the state. So essentially our food bank envisions a state where everyone, regardless of circumstance, has access to nutritious food. And we envision an Oklahoma that no longer struggles with hunger. So annually, we distribute about 57 million pounds of food, and we serve a little over 600,000 individuals through 1,335 community-based partners. So our focus areas are advocacy and public policy that influence food insecurity, disaster relief, of course, as I'm sure you've noticed from this last year, and then we also are broken up into different program sections. So we have our kids section, our health programming, our senior programming, and our community-based programming. So what is food insecurity? And just to warn you, you're going to hear me say food insecurity about 150 times today. But food insecurity is essentially the lack of access to enough food for a healthy and active life. It looks different for a lot of people, but just so you're aware, it is actually measured by the USDA on an annual basis. So they measure it through an 18-question survey through the current population survey. And they generally get about 40 to 60,000 response. So food security is broken up into 4 sections. High food security, essentially where you don't lack access to food whatsoever or have anxiety about accessing food. Marginal food security. So this is where generally there's not an issue with access or an issue with quality, variety, or quantity, but there's occasional anxiety about accessing food. Low food security, this is really where food insecurity starts. So this is reduced quality, variety, and desirability of diet. And then very low food secure, this is where they really lack money and other resources for food. Eating patterns change, people are skipping meals, and so forth. So to break that down just a little bit further, like I mentioned with low food security, the quality, variety, and desirability of diet decreases. And then very low food security, this is where you run into weight loss, people having to skip meals or skip eating for an entire day, sometimes very often, and even multiple months in a row. So if you look on the right, it's kind of interesting. Um, so for low food security, they couldn't afford a balanced meal or cut the size of their meal. Generally, with low food security, you're going to run into um, you're still able to eat, but you can't afford the healthy food. So generally, the healthy food is the more expensive food in the grocery store, right? So if you're low food secure, you're not going to be able to afford fresh produce. You're not going to be able to afford, the lean protein, dairy, and things like that. Generally, you're going to go a lot more for low cost, high sugar, high sodium type of things like ramen noodles, and a lot of other canned items as well. Also, important to note, about 3/4 of those who are food insecure are low food security, and then about 1/4 are very low food secure. So the majority of the people that we serve are low food secure. So how do households cope with food insecurity? So a study that was done showed that 53% receive help from friends, 40% water down their food, almost 80% purchase inexpensive, unhealthy food, 35% sell property, and 23% attempt to grow their own food. So studies show that over half of insecure households report having to use 3 or more of these coping strategies. So if you think about it, if someone is having to purchase inexpensive, unhealthy food and water down their food, their nutrient intake is definitely not up to par. And then coping strategies are meant to try and prevent major life trade-offs. So with major life trade-offs, this is where essentially big life, big a lot of things that are essentially needed in life are sacrificed in order to feed your family. So about 69% report having to choose between groceries and paying their utilities, like electricity, which can definitely be kind of a catch-22 because if you can't have electricity for refrigeration, then there's a lot of food you won't be able to buy, especially healthy food. 67% between food and transportation, which in Oklahoma is, kind of a big deal. You can't get anywhere, hardly anywhere without transportation. And then notably, especially in the healthcare field, is 66% between food and medication. So food insecurity is largely related to medication underuse or non-adherence because of choosing to skip doses, taking less than prescribed, delaying their filling of doses, and then also not being able to eat food that is instructed with the medication. And then also 57% between housing and groceries. Okay, so let's talk about food insecurity and chronic disease. Once someone develops a chronic disease when they're food insecure, it is almost impossible to escape food insecurity, and here's why. Once someone is food insecure and they develop these coping strategies, which decreases their diet quality and thus increases their likelihood of developing a chronic disease, um, they are having to go to the doctor more often. And if they don't receive paid time off, then they're having to take time off and not get paid. They're having to pay to go to the doctor. So their healthcare expenditures are going way up, and their employability is decreasing. They're bringing in less money, so it's just kind of a difficult cycle there. Then you also have the stress of everything that goes along with dealing with their chronic disease, as well as just trying to feed your family. And then as things progress, um, often what we see is people end up losing their jobs or having a hard time holding down their jobs. They're not able to pay for those major life trade-offs that we just talked about. So utilities, transportation, which is a huge one for holding down a job, and so forth. So it's really a vicious cycle with food insecurity and chronic disease, which makes it so important to try to prevent a chronic disease from happening. So here are diseases, health conditions, and health behaviors associated with food insecurity. So with children, of course, you're going to have behavioral and social emotional problems. Oftentimes with our school partners, they'll be able to identify food insecurity if a child is very lethargic on a Monday. Sometimes they're not able to eat almost all weekend. Iron deficiency, of course, low birth weight, low bone density, lower physical functioning, mental health problems, poor diet quality. And then with adults, you have arthritis, asthma, cancer, chronic kidney disease. We also see a higher rate of cigarette smoking. That is largely due to coping with stress, coronary heart disease, depression, diabetes, hepatitis, hypertension, and then the list was pretty long, so so you guys could actually see it. I shortened it, but obesity was a big one there as well. Older adults, congestive heart failure, depression, diabetes, hypertension, limitations in activities of daily living. This is actually a really, really big one. So this primarily focuses on cognition, endurance, and mobility. So if a senior individual is food insecure and has just one ADL, that is equivalent to being over 14 years older than they actually are. So that's a major issue. Lower cognitive function, obesity, osteoporosis, and poor health. So the cost of food insecurity is huge. Adults who are food insecure have a lot more emergency room visits and hospital admissions. As you can see, they spend a lot more time in the hospital, in hospital days, hospital admission, and emergency room visit. They actually spend on average over $1,800 more annually on healthcare than those that are food secure. And then additionally to that, so food insecure individuals with heart disease versus food secure individuals who also have heart disease. Those that are food insecure spend over $5,000 more a year. Those with diabetes spend over almost $4,500 more a year. And those with hypertension spend over $2,100 a year. So not only are they food insecure, but they're having to spend more than those who are food secure at the doctor, essentially. So I just want to touch on quickly what healthcare costs look across the nation. As you can see, Oklahoma isn't the absolute worst. Obviously, California and Texas are going to be way up there because of their population. But notably, a study that was done in 2014 estimated that direct and indirect health-related costs associated with food insecurity was estimated at $160 billion, and that's a year. Okay, so another super important thing to talk about when it comes to food insecurity is racial and ethnic disparities. So as you can see here, this is a graph from USDA, and they looked at race and food insecurity. And this actually shows that food insecurity rates for both Black and Hispanic Americans is twice, those who are Black or Hispanic are twice as likely to be food insecure as those who are white, which is a major issue. Additional studies that were done on food insecurity and American Indian or Alaskan Native also showed that if you were American Indian or Alaskan Native in America, you were twice as likely to be food insecure as whites. And that is a major issue. So obviously, the relationship between race and ethnicity and food insecurity is complex and clearly intertwined with other established determinants of food insecurity, which are poverty, unemployment, incarceration, and disability. And seeing what other speakers are speaking on at the same exact time, I just encourage you to go back and listen and watch their speeches today, because I think those will tie in really, really well to the underlying issue of food insecurity and race and ethnic disparities. So this is a quote that I really appreciated and wanted to share with you guys. While it is important that solutions to address disparities in food insecurity focus on combating interpersonal discrimination, the need to target structural racism is critical in the fight for achieving equity in food insecurity and improve related outcomes in people of color. Absolutely important. So I wanted to share what food insecurity looks like across the US. So back in 2019, the rate for food insecurity was at 10.5%. Obviously, we are very much expecting that number to rise significantly, and I will share a little bit more about that in a moment. So, Oklahoma. Unfortunately, Oklahoma is 5th in the nation in food insecurity. So 1 in 6 adults in Oklahoma are food insecure, and 1 in 4 children in Oklahoma are food insecure. And you can see on the map kind of where the biggest issues are in our state. So about over 635,000 people in Oklahoma are food insecure, and that's about 15.1%, which is 5% higher than the national average. So what is the food bank doing essentially to fight food insecurity? So the food bank, something that we talk a lot about at the food bank is feeding the line and shortening the line. So not only do we want to provide food to the people that we're serving who are food insecure, but we also want to do everything we can to pull them out of food insecurity. That's super important to us. We don't just want to provide a handout, we want to help them and empower them to escape food insecurity and live a happy, healthy life, essentially. So to feed the line, what our strategies are to increase the output of nutritious foods, increase the access to food in food desert areas, expand programs targeting vulnerable or at-risk populations, and continue to improve equitable distribution of foods. And there's always, always, always going to be room for improvement there. To shorten the line, we are expanding education and access to SNAP. So we really, really encourage the use of SNAP, which is also known as food stamps. We also have a SNAP application assistant, actually 2 now at the food bank, and we also work largely with Hunger Free Oklahoma to try and help people apply for SNAP. It's a little bit complicated, a little bit of a complicated process, so anything we can do to help people receive SNAP is ideal. Also coupling nutrition education and behavioral health strategies. Throughout our network, we do that with a program called Healthy Pantry, where the goal is to not only increase access to fresh and healthy food options in the food pantry network, but also create an environment that encourages people to choose healthy and empowers them to choose healthy for themselves. And then partnering with organizations that impact other areas of social determinants of health. That's really, really important to us. One example is partnering with federally qualified health centers, hospitals and clinics, county health departments, the state health department, And that's just kind of in the health field, but we partner with a lot of different organizations that focus on different areas of social determinants. We also do food insecurity screening. So especially in 2020, that's really important because as people unexpectedly fall into food insecurity who have never been food insecure before, it's important to identify those people as much as we can and introduce them and connect them to available resources. And then also motivational interviewing and case management. This is largely done through our food pantries, especially our food and resource centers, where we can connect them with multiple resources in addition to the food on site. So something that's really important to us is strategic partnerships and integrating our programs together. So for example, in one community, we might have every single one of these programs. Um, and that the reason for that is because we're trying to create kind of wraparound services and fill as many gaps as we possibly can. So not only reaching a high number of people, but also providing specialized services for those who need it. So one example is our senior servings program. Our senior servings program is for what I mentioned earlier, seniors who are dealing with activities of daily living limitations. And with this program, we screen for these limitations, provide extra prepared healthy meals for these seniors through the food pantry. So they're receiving these meals that help them cook at home for themselves, but then also the groceries as well. And we do this through our food pantry network, which falls under Food for Communities, and also in kind of in the food for health spectrum with nutrition and education. Okay, so let's talk about 2020 and technically 2021, but really 2020. What a year it was. I'm sure you saw the food bank on the news a few times, and Feeding America, which is the national organization that partners with about 200 food banks across the nation. It was quite a year, and our partners are incredible. They worked so hard to continue to um, serve their communities, and I'll talk a little bit more about that in this section. So first, let's talk about how COVID is impacting food insecurity. So some major determinants of food insecurity, like I mentioned, especially in 2020, is unemployment and poverty. And obviously, those are going way up compared to previous rate numbers. So unemployment, we're expecting to rise 6.6% and poverty 2.6%. And the projected annual food insecurity rate is expected to rise 4.1%. Like I mentioned earlier, it was at 10%. And then projected food insecure people is expected to rise 13.2 million. So the annual food insecurity rate for Oklahoma is projected to rise to 18.6%, which is a little bit less than the national average, but it's still very much significant. Okay, so Oklahoma. We've had some absolutely incredible partners partner with us, not only just across our state with our food pantry network, but also we've had some incredible organizations partner with us in disaster relief as well. We couldn't bring in volunteers after everything kind of broke out in March. And so the National Guard actually came out and worked in our volunteer center, which enabled us to continue to move food out as quickly as possible. Our food pantry partners largely have stayed open across our service area. We have over 320 food pantry partners, and they're all within their own communities. It's throughout our 53 county service area, and the majority of those have stayed open as well. We also have community partners that we've partnered with, and as you can see in the right-hand side, we partnered with Western Heights, which is a high need area, and we were able to partner with them and get food out with them as well. So I'm sure you saw on the national news last year videos, I mean, it was all over the media, videos of food banks conducting mass distributions where people were waiting in line for 9 hours at a time. You know, cars were breaking down, running out of gas. People would show up and wait for 8 hours and not end up getting any food because the food ran out. That was absolutely something that we did everything in our power to actually avoid. And that's because the strength of our partner network is unlike almost every other food bank in the nation. They are absolutely incredible. We throw all of our resources into our network, and here's the reason. We believe in a community-based approach to everything. You know, the food bank, as a food bank, we don't want to come in and just try and solve everybody's problems, because that's not possible. Our community partner network is incredibly strong. Almost 100% of them have remained open, which is pretty much unheard of across the nation. Most of them were able to adjust to safe distribution methods almost immediately. And almost all of them have been trained in disaster response. As you know, we get a lot of disasters in Oklahoma. I think we're actually third in the nation in disaster. So they're very well trained in disaster response. And then they're also very well established within their own communities. So that's really, really important, because especially in Oklahoma, you don't want people having to drive 3-4 hours just to wait in line to get food somewhere. And then also they provide a sustainable food access and other resources. So this is key for someone who is newly food insecure. This way they are able to go to a food pantry and not only get food one time, but have access to it month after month after month until they no longer need it. So that's another reason why mass distributions are something that we avoid, because it's just food for one time, but we want to provide sustainability for our clients. So in addition to our food pantry network, we also partnered with some disaster partners very strategically. And here's a list, a very vague kind of general list. We partnered with so many, I can't even tell you. Actually, I can tell you. Ever since the beginning of COVID, we so far with partners very similar to this list have partnered with over 300. We've done over 300 disaster distributions, distributing over 1.4 million pounds of shelf-stable pantry food, as well as 5.6 million pounds of fresh produce, meat, and dairy. So through these partnerships alone, not even including our food pantry network, we have served over 60,000 households. So we're very, very proud of these partnerships. These are all in addition to, like I said, in addition to what we're already doing with our food pantry network, and we absolutely are appreciative of these partnerships. And then lastly, I just want to touch real quick on policies that have really helped us combat food insecurity in 2020. SNAP is a huge one. The 15% increase in SNAP benefits made a huge, huge difference. It also waived certain requirements for college students. Also, there's a lot of money put into the Emergency Food Assistance Program, also known as TFAP, and increase the qualification to 200% poverty line. We use a lot of TFAP food products for a lot of our programs, and so that really enabled us to not only serve more food with TFAP food, but also serve more people because they raised the poverty qualification. Also, of course, I'm sure you've heard about Farmers to Families, or CFAP, which came from the federal government, which were essentially boxes of fresh produce that we were able to give out. And then the Dairy Product Donation Program. And then, of course, the stimulus checks. Every time a stimulus check went out, we always saw a significant drop in numbers, and it really not only helped people buy groceries for themselves, but helped our network kind of take a breath and helped things stabilize a little bit. So here are my references from today. A lot of these places are great places to go to if you want to learn more about food insecurity. Feeding America, of course, does a ton of research on food insecurity, and Hunger and Health also does a lot of research on food insecurity and health. So that is what I have for you guys today. Thank you so much for letting me speak. I would be happy to take questions.
So I know a question that a lot of people had submitted beforehand was ways that you can get involved and help during COVID, since we can't really like be directly volunteering. So I just didn't know if you knew any ways that people like
Yeah,
small brands could
yeah,
help.
sure. So obviously, obviously financial donations help a lot because we have to purchase a lot of food. Our food, basically our food sourcing has really changed a lot. We haven't been getting nearly as many food donations, which would also be a huge help. Another thing is, although the food bank still isn't allowed to bring in volunteers quite yet, a lot of our food pantry partners could use volunteers. So if you'd be willing to volunteer at a food pantry, that would be fantastic. You'd actually get interaction with clients, and the majority of our food pantries have temporarily changed into a drive-through method. So it's safe, socially distanced. Essentially, it's kind of like Walmart pickup, where they just pull up, you open their trunk, put the food in, and then they drive away. So if you're ever interested in that, you can actually find a food pantry on our website. You'll just go to the food pantry search area, and you'll be able to find them anywhere.
All right, another question from John Grady says, what about restaurant and supermarket waste? Seems like it would be a huge source if it could be harnessed and programized somehow.
Oh yeah, absolutely. So we actually have a program called Retail Recovery that we actually started in Oklahoma, and now it's a national food bank program. So with this, what we do is we partner restaurants and grocery stores in different areas with their local food pantries. So any extra food, instead of throwing it away, they actually donate it directly to the food pantry. Many of these places actually provide donations on almost a daily basis. So it's incredible. It's such an incredible partnership, because most of the things they want to get rid of immediately are the fresh product, because it goes bad a little bit quicker. And so that is what is so helpful in supplying a lot of our food pantry partners with fresh product. and they get it directly from their own community. So it just goes right back into their own community.
That's actually really cool. Okay, one more question. So, whenever Governor Stitt had the day of fasting, did that like lead to you guys getting any more donations or any more awareness? Did that really help the food bank at all?
Not that I'm aware of. Mm-mm.
And I think we have another one in the chat.
Okay.
Are there any attempts to create laws that perpetuate food deserts, such as raising prices of healthy food in low income areas or minimizing advertising for unhealthy foods in those areas? That don't perpetuate, sorry.
Oh, so I know Nikki Knight, that's something Nikki Nice is working very heavily on. And I don't know if you guys have heard from her quite yet. I think it's maybe this afternoon. Um, but she works really heavily on that. We also have an advocacy and public policy director who works on a lot of policies that affect food insecurity. Um, we don't do a lot with that as the food bank, um, but we support policies in motion that do um, that are preventative of food deserts and raising prices of healthy foods and things like that. So obviously, that is a huge part of food insecurity is access to healthy food um, and yeah. So we support those things as much as we possibly can. I don't know if that answers your question. It's a little bit of a vague answer, but
I said it did, thank you.
okay, good.
Does anyone else have any more questions or thoughts?
I have one quick question. Are there right to garden issues here with like the double strip of lawn, or are there issues with like ordinances where you can't grow food in your front yard?
That's not my area of expertise, but I believe that is kind of an issue where you're not necessarily allowed to do that, and I assume it's by county. We have several food pantry partners who do have a garden. It is a ton of extra work. I think it's a lot more work than people realize sometimes whenever they start a garden. But if you have um, experts in that area who are willing to volunteer um, frequently for that, then it's a great option and a lot of help for our food pantry partners. But I can't say I know the exact answer to your question. I'm sorry.
Anyone else? Last questions? All right. Well, Keeley White, thank you so much for being here and for giving the talk. It was really insightful, and hopefully, we'll see some medical students and other people at this conference volunteering at food pantries. So,
Yeah. Thanks so
thank you.
much for having me.
Of course. And then for people at Bridges to Access, I believe that we are just going back to the main meeting, and then we have a break until 11:15 when we'll split up into breakout rooms again for a poverty simulation. So I think you can leave the breakout room and go back to the main meeting. But yes, thank you so much again.
Yeah, of course. Thank you guys for having me. Have a good day.